Hello, this is Dr. Barbara Oswald, and here is an overview of what we're going to cover in Module 1 in our PSS 312 Drugs and Behavior class. Module 1 covers drugs in society and our lives. We have several student learning objectives in this module, starting with number 1. You will learn to describe at least 6 ways that drugs are classified, identifying advantages and disadvantages of each of those classification methods, and you will get to assess your knowledge of this learning objective through homework question 1. Next, you'll learn to identify 3 components that make up a drug experience and explain why this is important. This will be assessed through homework question 2. You will also learn to describe current drug and alcohol use prevalence rates and evaluate the reliability of various prevalence rate sources. And we talk about prevalence rates through a variety of activities in class, including discussion options 1 and 6 and homework question 3. Next, you'll learn to explain the difference between physical dependence, psychological dependence, craving, tolerance, and withdrawal, and identifying which of these defines a substance abuse disorder. And we'll assess these through discussion options 5 and 6, homework question 5, in our Module 1 exam. Next, you will learn to evaluate the historic and current impact of drug laws on drug use, considering both positive and negative impacts of drug laws in our society. And this will be covered through discussion option 3 and homework questions 4 and 6. Finally, in this module, we will critically examine the Controlled Substances Act and the Schedule of Controlled Substances. And we'll discuss this in our discussion option 4, and you will get to test your knowledge through homework question 7. So what you will do for Module 1, you'll need to read all of chapters 1 and 2 in our assigned textbook. You'll need to read the Module 1 research article, which will be provided to you on Canvas. You'll want to take the practice quizzes in Canvas over chapters 1 and 2. These are low stakes, 5-question quizzes that you can take multiple times until you're happy with your grade. You'll see different questions each time, and this will help you for the Module 1 exam, which will have 25 multiple choice questions drawn from those same practice quiz questions. You'll also get to participate in the Module 1 discussion, complete the Module 1 homework questions, and complete the Module 1 exam, which will have 2 parts. One are the multiple choice questions over the chapters, and the other are essay questions over the Module 1 research article. So, in just a few minutes, I'd like to spend some time going over what are the core items that we're going to cover in Module 1 so that you sort of get an idea of what you should be focusing on in this module. So the first thing that we'll do in the modules will define psychopharmacology. Psychopharmacology refers to the scientific study of the effects of drugs on the brain and behavior. I actually happen to be trained as a psychopharmacologist. I got my master's degree and PhD in psychopharmacology laboratories, and I completed a postdoctoral research fellowship in neurotoxicology with a focus on neuropsychopharmacology. So this class is right up my alley. I love teaching this class, and I hope you'll enjoy learning with me. So what we'll want to cover first in this module is how drugs are classified. How drugs are classified is very confusing because there's multiple ways that people classify drugs. Sometimes drugs are classified by their origin. For example, opiates are classified oftentimes by their origin as substances that have originated from opium, from the poppy seed. Other times drugs are classified by their therapeutic use. So for example, we talk about several types of psychotherapeutic drugs in this class, drugs that are used to treat mental disorders, or other drugs are classified as opiates because their therapeutic use is to treat pain. Drugs then are also classified by their site of action, or literally the effect that they have in the brain. Do they increase neural activity in the brain, or do they decrease neural activity in the brain? Drugs are also classified often by their chemical structure. For example, you might remember in Biopsych, Psych 251, you learned about serotonin, which is abbreviated 5-HT, which stands for its chemical structure, 5-hydroxytryptamine. So sometimes drugs get classified like that. Sometimes drugs are classified by their street name. I don't know what current street names are, but you may hear like crack or meth or things like that are sort of abbreviations for crack cocaine or methamphetamine or crystal meth or ice, those kinds of things. In this class, we're going to classify drugs according to the site of action of their main effect. So this is a little complicated too, because as you know, all drugs have many effects. Alcohol in low doses in many people functions as a stimulant. However, the main effect of alcohol is actually to depress activity in the central nervous system. It tells neurons to stop firing. And that's why in higher doses we see that depressant effect. People pass out, fall asleep, they start to lose control of normal bodily functions like walking and talking and things like that. Same thing with cocaine, in low doses, it may, perhaps help people to calm down or whatever, but in the central nervous system, it makes neurons fire more, and overall it has a stimulating, and in high doses, an actual convulsant effect. It will cause seizures. So pay careful attention to that in the book, how drugs are classified. Next in the chapters, we'll talk about the drug experience and what affects what people experience when they take drugs. For example, a lot of people find cocaine very rewarding and they find it to be a very positive experience, but plenty of other people don't like how they feel under the effects of cocaine at all. And so individual factors can affect the way that we respond to drugs. So the drug experience is made up of three main things. Number one is the dose. As I just mentioned, low doses of drugs have one effect. Higher doses can have a completely different effect. So the dose is an important factor. We'll also learn about the route of administration, which means how a drug is taken. Depending on how you take a drug will significantly impact the effects that it has. For example, let's say marijuana. Marijuana can produce different effects based on how it's administered, if it's smoked versus if it's eaten in a consumable. So we will consider several routes of administration and talk about that, how that affects our drug experience. Then we'll also talk about the set or an individual's psychological expectations about what they think they're supposed to experience by the drug, and also the setting, the place where the drug is used. All of those can affect our drug experience. Next in the book, we'll talk about prevalence rates. How many people in the United States drink underage, for example, or use heroin or smoke? We have lots and lots of data on prevalence rates, both in the U.S. and worldwide, and we'll talk about several of those sources of where we're getting that kind of data in the world, and we'll also consider the reliability of those sources. Most of the sources are surveys, and so we can start thinking about the reliability of data that's coming from these surveys. Next, we'll talk about the DSM, the Diagnostic and Statistical Manual. We're in the 5th edition, so the DSM-5, criteria for defining a substance abuse disorder. And then we will talk about some principles of drug action, including tolerance and withdrawal. Finally, in this module, in Chapter 2, we'll start talking about the history of drug and alcohol use in the United States and worldwide. And then we'll really start investigating the American drug laws and the war on drugs that began in the United States in the 1970s. And we'll finish up this chapter by thinking about how effective that war on drugs is, as well as all of the drug laws and legislation. And we'll talk about how that plays into the DEA, or the Drug Enforcement Agency, schedule control of drugs that lists, according to 5 schedules, what drugs are considered legal, over the counter in our society versus legal by prescription only, versus, the Schedule 1 and 2 drugs that Schedule 1 that are absolutely not legal for any use at all and carry a mandatory jail sentence. And Schedule 1 drugs currently include federally things like marijuana, LSD, MDMA, and some other, heroin, of course. But marijuana, LSD, and MDMA are all used therapeutically, and so it'll be interesting to see if we can ever get those drugs off the Schedule 1. All right, if you have any questions about this module, feel free to email or ask at any time. I look forward to learning with you this module.